The reason I went into orthopedics is because it gave me the opportunity to really help people. Actually, I decided to go into medicine when I was about 12 or 13 years old, when I diagnosed my Cocker Spaniel as having bladder stones. After that, I decided maybe I'd be a doctor. I got interested in orthopedics when I was in high school and trying to play basketball at Lanier High School here in Macon. Came down with a variety of different ailments. Was impressed by the treatment I got, and I thought that orthopedics gave the opportunity to not only use my sports background, but also the ability to provide medical care. Some branches of medicine, you can't really do a whole lot to help people and see them get well. Orthopedics is different. We can prescribe treatments or surgery and actually see an end result and see our patients get well, really improving their quality of lives. In our practice, we feel like the key to orthopedic treatment is patient education, getting the patient involved in their own care, and that's why our mission is getting better together. Getting patients well is not something the doctor can do alone or the therapist can do alone. It's a combined effort. Getting better together really describes what we're striving for at Forsyth Street Orthopedics. When I finished up my training back in the late 1970s in Memphis, I had to make the decision on where to practice. My family, my mother and father, still lived here in Macon. I'd grown up here, and I felt like this would give me the chance perhaps to take care of some of the friends I'd grown up with, as well as their parents, and Macon was mighty good to me when I was growing up, and I'm very grateful I've had the chance over the past 32 years to pay back a little bit of that debt. When we first started our practice, we basically did a little bit of everything. Over the years, as we developed our practices, we began limiting our practices to some extent. And I found out after a period of time that what I really enjoyed doing was taking care of sports injuries, and particularly injuries involving the hip and the knee. A lot has changed over the past 30 years. When we look back on the 1970s, what we did back then was somewhat crude to what we're able to do now. Not only with the surgery we do, but also in the rehabilitation, particularly with qualified physical therapists like Tommy Williamson and his staff at our facility. The techniques of physical therapy and reconditioning have improved dramatically, and this has been a great benefit for our patients. Serving on the board of the directors of American Academy of Orthopedic Surgeons has been of tremendous benefit to our practice, and certainly to me personally. Not only did it enable me to be on the cutting edge of developments in orthopedics and bring to my patients the very latest in surgical and orthopedic techniques, but also it enabled me to make contacts across the country and actually throughout the world. If we have a patient that is going elsewhere, moving elsewhere, it's great to be able to pick up the telephone and call one of my friends in states across the country and be able to arrange follow-up care for my patients. Having had the opportunity to take care of a number of patients, particularly knee patients over the years, I was able to participate in the design of a special type of knee prosthesis. This was a group effort. There were about 14 orthopedic surgeons from around the country. After meeting with engineers and designers, I'm glad to say it proved to be a very worthwhile, a very good prosthesis, and now has been implanted probably in 50 to 100,000 patients. So it was a great opportunity for me to be involved from the ground up, if you will, in the development of something that has brought, I think, a lot of benefit to a lot of patients. Arthritis is a condition that probably all of us get if we live long enough. So we see a lot of patients with arthritis. Thankfully, during my practice years, the treatment of arthritis has improved dramatically. It's incredible what physical therapy exercise, losing weight, making sure your muscles are as strong as possible, it's incredible what that can do to treat an arthritic hip or an arthritic knee. And more recently, over the last several years, they've actually come out with what my patients call rooster comb injections. This is a medicine that's actually developed from rooster combs and is also a treatment for arthritis, particularly for an arthritic knee. It doesn't cure the process, but it certainly helps to make the symptoms better. And of course, what we do so many times if our treatment doesn't work is knee replacement surgery, particularly for an arthritic knee. I've had my own knee replaced about 3.5 years ago. And having suffered with an arthritic knee and the pain and stiffness of an arthritic knee for many years, I can testify personally to what a tremendous procedure that is and how wonderful it is to be relieved of pain and get back to doing things that I could do 5, 10 years ago without hurting every step.